Good morning and afternoon. My name is Kate Robb, and I'm the Senior Program Manager of Environmental Health with the Center for Public Health Policy at APHA. Thank you for joining us for today's webinar, Mobilizing Public Health to Achieve Environmental Justice. If you are new to this topic, we encourage you to become familiar with some of our APHA resources, such as Creating the Healthiest Nation, Environmental Justice for All fact sheet, and a webinar co-hosted with the National Environmental Health Partnership Council, Achieving Environmental Justice in the 21st Century, The Way Forward. This is the sixth and final webinar of the Advancing Racial Equity webinar series of 2020. We launched the webinar series in June to give an in-depth look at racism as a driving force of the social determinants of health and equity. This series has explored efforts to address systems, policies, and practices designed to limit and shape opportunities for people of color. In all webinars, the presenters highlight collective and individual actions we can take to advance racial equity and justice. To help you use the webinars to initiate or deepen anti-racism efforts in your organizations, schools, and communities, we've developed a discussion guide, part 1, to be used along with viewing the webinar recordings. Whether you've attended every webinar or if this is your first, this is an excellent resource for continuing your journey of learning and unlearning. The guide provides webinar summaries, thought-provoking questions, and engaging activities. It can be found on our Racial Equity webinar series page. Keep an eye out for part 2 of the discussion guide in December. If you've joined us for other webinars in this series, the next resource you may be familiar with, it is APHA's book titled Racism, Science and Tools for the Public Health Professional. This important publication builds on the racial health equity work that public health advocates and others have been doing for decades. It is available on the APHA website. Though this is the last webinar of the Advancing Racial Equity webinar series, APHA will continue to advance racial equity in 2021 and beyond. We are currently tracking racism declarations across the country and monitoring what actions state and local leaders are taking in alignment with these declarations. We will work with our members, affiliates, and partners to help hold leaders accountable for meaningful policy and practice changes to dismantle structural racism and create new systems, policies, practices, and norms. In addition, we will be hosting mini webinars to walk participants through various tools and processes that they can use to deepen their understanding of structural racism and for practical application of a racial equity lens to policies and programs. Lastly, we wanted to share information about the next COVID-19 Conversations webinar scheduled for tomorrow, November 18th at 5 p.m. Eastern, that will discuss a path to COVID-19 vaccine, including steps forward in development, approval, allocation, and distribution. We are grateful for your participation today and your attention to this critical topic. We also want to give thanks to the Environmental Justice Committee of the Environment section for working with us to present such a strong panel of experts. Before I hand it over to today's moderator, I want to go over a few housekeeping items. Closed captioning is available for our webinar. Instructions for accessing closed captioning are in the chat. The webinar is being recorded. All registrants will receive a follow-up email with a link to the recording and slides, which will also be posted on APHA's website within the next week. Today's webinar has been approved for 1.5 continuing education credits for CHES, CNE, CME, and CPH, and none of the speakers have any relevant financial relationships to disclose. If you want CE, you must be registered with your first and last name and participate for the entire webinar. All registered participants will receive an email within a few days from cpd@confex.com with information on how to claim credits and relevant deadlines. After hearing brief presentations from the panelists, we will have a moderated discussion among the panelists and then turn over to the audience for questions at the end of the webinar. You can ask a question by entering it in the Q&A function. The chat function is disabled for participants and being used for announcements only. At the end of the webinar, you will be redirected to a survey. Please take a moment to fill out this 2-minute questionnaire to help us improve our future webinars. And follow the conversation, today's conversation on Twitter using #RacismOrHealth and #APHA webinar. Finally, I'd like to cover some meeting norms for this webinar. Get and stay curious. Lean and breathe into discomfort. Inquire to learn rather than to demonstrate knowledge. Avoid playing devil's advocate. Learning and unlearning goes beyond this webinar. Refrain from immediately reaching out to BIPOC colleagues to discuss the webinar. Take time for your own reflection and reckoning. If and when you do reach out, get their consent to discuss. Now I would like to introduce today's moderator, Crystal Dixon. Crystal currently serves as the chair of the School of Health and Human Sciences Diversity, Equity, and Inclusion Committee, and has been appointed to serve on the Chancellor's Advisory Committee on Equity, Diversity, and Inclusive Excellence at UNC Greensboro. As a visiting research scholar for the Office of Diversity and Inclusion at Wake Forest University, she is actively working to institute institutional change to address structural racism in higher education. Crystal currently serves as a community engagement and research support team member at the Anna Julia Cooper Center and works to promote scholarship and community activism through exploring the intersection of race, gender, and place. I'll now turn it over to you, Crystal.
Great, thank you so much, Kate. Many thanks to all of you for joining today's webinar. I'd like to share some remarks and set the stage for today's discussion. Michelle Alexander states in her book, The New Jim Crow, since the nation's founding, African Americans repeatedly have been controlled through institutions such as slavery and Jim Crow, which appear to die, but then are reborn in new form tailored to the needs and constraints of the time. Systemic racism is the new Jim Crow, and Black, Brown, and Indigenous communities continue to be oppressed by the unregulated environmental practices of corporate America. Our homes are built in flood zones, and we are exposed to toxic contaminants, some which are not yet regulated by the EPA. Toxic waste dumping, particulate matter, and contamination in drinking water are creating health disparities and chronic conditions, and in some cases, premature death. Environmental racism continues to disproportionately assault the lives of Black, Brown, Indigenous communities in this country. While many have recently awakened to their newfangled knowledge of systemic racism, social justice and public health have always been inextricably linked. For the past 2 decades, the denial of human rights and environmental protection has raised awareness of environmental racism and injustice. It is also imperative that we explore cleaner and more sustainable energy options to curtail the rising greenhouse gas emissions contributing to global warming. Sea level rise will continue to submerge land across the globe, potentially displacing millions of people from their homelands. In fact, according to the Institute of Economics and Peace, in the next 30 years, 1.2 billion people are at risk for being displaced. So as I conclude, please recognize that environmental discrimination and unsustainable practices have historically impacted communities of color. Dr. Robert Bullard reminds us in his life's work that these discriminatory practices were the impetus for grassroots efforts and have birthed the environmental justice movement in the late 1970s and early 1980s. Environmental racism is a public health crisis. We must recognize environmental racism as a pre-existing health condition impacting communities of color. Environmental justice is needed now. So without further ado, I'd like to introduce our first presenter. Donna Chavis is an elder of the Lumbee tribe of North Carolina and resides in the tribe's ancestral home of Pembroke, North Carolina. She has over 40 years of service in the nonprofit and philanthropic sectors of the local, state, and national level, and currently serves as senior fossil fuels campaigner with Friends of the Earth US. Donna is a recognized leader in social and environmental justice change in practice. She was a member of the planning committee of the first National People of Color Leadership Summit in 1991, which developed the principles of environmental justice. She remains committed to those principles and has specifically integrated them in her work over the past 4 years in opposition to the Atlantic Coast Pipeline. Donna, please begin.
Thank you so much, Crystal. And it's so nice to be with you today. It's also nice to hear Bob Bullard's name, as he also sat on the planning committee for the summit. Made some really nice connections there, and it's always nice to hear those names lifted up. Before I start, though, I do want to give a land acknowledgement that I'm coming to you today from Pembroke, North Carolina, which is the ancestral home of the Lumbee people, which is the tribal nation to which I belong. And I thank you for the opportunity to speak to this august body this afternoon. Between 1982 and 91, the way that environmental and community organizing was perceived changed forever. And you know some of the reasons why. It only took 4 words to launch that change. Those were environmental justice and environmental racism. In 1982, the United Church of Christ Commission for Racial Justice was involved with the efforts in North Carolina, in Warren County, to stop PCB dumping, which was at that time was whenever the term environmental racism was first coined. And that continues to be so effective today. Then again, in 1987, the UCC released their report, Toxic Waste and Race in the United States. And after that was released, the terms environmental racism and environmental justice became a part of the regular organizing lexicon. And as you've already mentioned, in 1991, we did have the first National People of Color Environmental Leadership Summit. Communities now had been organized for decades on issues of toxic waste siting, public health, or land and water rights for years. Toxic Waste and Race was a landmark report because it was the first time that a focused lens had been used to evaluate these concerns. It found that race, not income, was the single most important factor in where waste was cited. But of course, most of you probably already know that. The report documented disproportionate environmental burdens facing people of color and low-income communities across the country. It sparked a nationwide grassroots environmental justice movement and signified academic and governmental attention. Then in 2007, the UCC commissioned another report, Toxic Waste and Race at 20. Unfortunately, that report showed that the same issues that were documented in 1987 remained. Now, you've already mentioned that at the 1991 summit, the environmental justice principles was released. I want to point out the key word in that, and that is justice. At that time, when we were planning, we all knew that there would be so much diversity at the summit, there had to be intentionality in everything. Justice, the word justice and its practice superseded all the differences. We all had our stories of injustice, but we were all aligned with the goal of environmental justice. I find myself today needing to bring that point up often because when we get in conversations about environmental justice, so often we end up pointing out all of the injustices and not getting around to talking about how do we get to justice, how we get to the change that will help to mitigate some of the circumstances. So let's jump to the present right now. The most recent campaign that I was involved with was the effort to stop the Atlantic Coast Pipeline. Now that pipeline was a 600-mile, it was a proposed, I like to use the word proposed, 600-mile pipeline that would have crossed through West Virginia, Virginia, and North Carolina. Along the way, the routes that it ultimately was planned for went through many environmental justice communities of low wealth and people of color. And it was important that the work that we did actually focused on the fact that the route was not only bad because of the environmental impacts, but it also had such a negative effect on the communities and the people in those communities. Now, as I was working on that particular campaign, part of the work was not only to work with coming up with opposition, but to find ways that communities connected through their common good and began to build bridges across the differences that may be present in those areas and with those peoples. We had, for instance, in North Carolina, along the route, there was over 30,000 indigenous peoples who were going to be directly impacted by that route. And yet the DEIS, the Environmental Impact Study that FERC approved, that's the Federal Energy Regulatory Commission, stated that there was no disproportionate impact to any particular group along that route. So part of our job was to show how that was incorrect. And that meant that we needed to work together across the differences of geography, race, class, and gender. The interesting thing that was that whenever we focused not on what we were against, but what we were for in terms of the needs of the community in areas of education, public health, etc., it was easy to cross those boundaries and to find the places where we can connect and work together for the common goal and the common good. And so the lessons that I learned from that was that one of the things that is important was to enter into conversations where we are listening with curiosity rather than listening for what the solution may be or what the solution I may have that I think I have. And it went a long way of communities learning about each other, appreciating the ways in which we could connect and how to move the goals forward. And all of you, I don't know if all of you know, but we were very glad to celebrate the July 5 this year, July 5, 2020, which I call a Interdependence Day now, that Duke and Dominion announced that they were canceling the Atlantic Coast Pipeline. That was a huge success because that was a $4.5 billion project that ended up costing $8.5 billion and cut across the 3 states and ultimately had plans to go in a 4th state, South Carolina. It was definitely a case of coming up against the giant and being able to bring that giant down. But the lessons we learned out of that, once we stopped celebrating and began to look back on what was happening, were many. And one of those, I've already shared some of those, but one of those that really stood out was that there was a great need for the departments, agencies, and divisions of state government, especially, the need for an environmental justice tool by which actions or decisions are measured. What we discovered that was needed, and there was a lot of disjointed work going on at the state level in terms of citing locations for industry, whether they were good industry or dirty industry, lack of communication between these divisions. And the only division that had any sense of environmental justice tools was the Department of Environmental Quality. And they use those rarely, actually, and had to be called into accountability often. So one of the things that we began to advocate for was at the state level, some work that could actually come out of the governor's office and didn't take legislative decision-making, was to begin to look at how a tool could be put together, and it would be overseen by the Department of Environmental Quality, that allowed these divisions within the administration to be able to make judgment calls related to sightings or other development in relationship to the environmental justice criteria that would be a part of this tool. That was an objective action that could be taken that didn't have any political ramifications, plus or minus. It was a very solid recommendation. And I'm glad to say that in North Carolina, that is one of the things that is being developed in terms of every department in the Department of Administration must evaluate their work with some environmental justice tool. And one of the other things that was a huge lesson was that while a lot of focus is put on the national level, especially with legal challenges to some of these efforts, that much can be accomplished at the state level. So some focus, more than usual, was placed in the state decision-making, and especially with the Department of Environmental Quality. I like to say that showing up at every meeting is important. Sometimes being the first there and the last to leave can make the big difference. And in that case, I know for me personally, I attended every single meeting of the newly formed Secretary's Environmental Justice and Equity Policy Advisory Board. And in that process, every meeting, the number of people present in that room grew, and they were making comments and suggestions to the committee every day that the meetings were to go on. And I want to tell you that one of the things that just happened recently, after a very bad decision to permit a wood pellet plant, the Secretary of DEQ came out with a statement saying, we must do better. It's not right the way decisions are being made now. And he had heard that for 2 years. And it was very nice to hear that he finally accepted that and made the statement that they were going to take steps to do better and not to leave communities out of the process. So the focus on the state level decision-making is as critical as the national. And I think I may be running up on my time. How am I doing, Crystal?
Yes, Donna, yes, if we can conclude here, that'll be great because you've done extraordinary work, and I would like to hear more about our panelists as well. But wow, that's phenomenal. If we can conclude here, then we can circle back to finish that conversation.
Yes, I did have a little more, but I do want to stay on time because we have such good presenters throughout. Thank you.
Great. Thank you so much, Donna, for providing us a brief history of the environmental justice movement. That's phenomenal. Donnell Wilkins has dedicated her life's work towards improving the quality of life for Detroiters through environmental and social justice. She is the founding director of the Green Door Initiative, a nonprofit organization promoting environmental justice in Michigan. She is sought after as a public speaker. We're so glad she was able to join us today. She's a recipient of many awards, and most recently, she was named an innovator with the Campaign for Black Male Achievement. So for more than 2 decades, Donnell has led movements for environmental justice, played a key role in developing the Michigan's environmental justice policy, and she's launched the city's first green jobs training program, advocated for citizens' involvement in public policies, citizen science, and placed environmental stewardship on the agenda of community leaders and decision makers. Donna, please begin.
Thank you so much for having me today. I really appreciate the opportunity to share some of my experiences. I chose the title of my talk, my 5-minute sort of talk, In Pursuit of Environmental Justice. And I will say thank you, Donna, for setting the stage and the context, especially mentioning the first People of Color Environmental Leadership Summit that took place in 1991, because that really launched my life's work. Next slide, please. We were challenged from that particular moment as a delegate when we got done with creating the 17 principles of environmental justice to return to our communities and get a movement started. While I am the founding director of the Green Door Initiative, I also, at that point, served as the founding director of Detroiters Working for Environmental Justice, and was able to raise the issue of environmental justice throughout the city and the state of Michigan, and led that effort for 15 years. That brought me to creating the Green Door Initiative, and where we have taken the work of achieving and seeking the achievement of environmental justice to another level with regard to what does environmental justice look like should we really become confronted with it. Next slide, please. So we are located in the city of Detroit, and I just really wanted to just kind of make sure everyone's on the same page here, because the environment was defined differently in that 1991 powerful meeting, where we really wanted to make certain that folks understood we were talking about where we live, where we work, where we play, where we learn, and the physical and natural world in which we resided. That defined the environment. Next slide, please. I always, from this point on, I want to acknowledge someone that keeps me focused and on track with regard to the work that we do, because public health is a major driver. Health is a major driver for many of us on the front lines as we work to find the key to achieving environmental justice. I want to acknowledge Xavier Joe, who lost his life too early at 10 years old. Xavier died because he could not breathe. That term, I can't breathe, is not a new term. Environmental justice advocates know very well that we have been fighting to breathe for decades. We fight to breathe clean air. And this young person died because he could not breathe. And he died because of a preventable disease, asthma. He died in his mother's arms because she did not have access to transportation. And when she called for 911 support to pick her up so that her child could get somewhere where they could get the help they needed, they were not able to get there in time. And he slipped away and he told her it was going to be okay. I believe that it is my job and many others to make certain that his life is not one that was done in vain. Next slide, please. So racial profiling is a huge issue. And it's one of those things that I also want to make certain that we put a face on this. The environmental justice movement is about putting a face on the environmental inequities and injustices and that comes along with it. Flint, Michigan stands out and remains to be one of the poster childs of this issue for me. Next point, that this particular, the Flint water crises put children and communities that were of color and poor at risk. More than 12,000 children were poisoned as a result of it. Next slide, please. I want to make sure that you understand when we talk about what it looks like to be impacted because of race, what that looks like. Next point, please. Detroit happens to be one of the most polluted cities in the United States because we placed the world on wheels. And because we did that, we have been left with the contamination and whatever that speaks to that. Next slide, please. I just want to continue to put in front of you what it means to be exposed to injustices. This Detroit, if you know anything about Michigan and Southeast Michigan in particular, Detroit is surrounded by very affluent suburban communities. Every dot that you see on the Detroit map represents some kind of toxic release. And just miles away, north of Detroit, is West Bloomfield, just a few miles away, and where you can barely see a spot on it. We have the Environmental Protection Agency that is supposed to provide protection for everyone. As a tax-paying citizen in this country, it is a real problem when, I'm sorry, my 5 minutes are up. It is a real problem when our taxes don't afford us equal protection under the law. Dr. Bully put it this way: we have the wrong complexion for protection. And it is time for us to replace the "I can't breathe" comment to replace the implicit bias and other things that ignore systems that have placed us disproportionately in harm's way. We need to replace that. We need to change that. And we need the public health community to get behind us on this and not continue with this idea that there's something wrong with us if we're always complaining from communities like ours, that our health issues are not founded in something legitimate. It is. And it's time to disrupt the systems that have created this. Thank you. And I'll stop there.
Wow. Thank you so much, Donnell. That was important that you reemphasize what Donna mentioned, as well as what we're going through. We cannot breathe. It's been happening for such a long time. So thank you. So our next presenter is Dr. Shakobi Wilson, an environmental health scientist with nearly 20 years of experience in the field of environmental justice. He is an associate professor and directs the Community Engagement, Environmental Justice, and Health Laboratory at the University of Maryland, College Park. Dr. Wilson has expertise in environmental justice science, environmental health disparities, environmental racism, air pollution monitoring, built environment, climate change, CAFOs, water quality monitoring, CBPR, citizen science, community science. He's a scholar, resilience, and community university partnerships. He is a former chair of the Environment Section and a co-founder of the EJ Committee, member of the National Environmental Justice Advisory Council, on the board of the Citizen Science Association, former board member of CCPH, and editor and the chief of Environmental Justice. He co-founded the DMV EJ Coalition in 2017 for Peace and Justice. Dr. Wilson previously won the Environment Section's Damian Smith Award and the NCEJ Network's Steve Wing International Environmental Justice Award for his leadership in environmental justice research and advocacy. Jacoby is a giant, so we're excited to have him with us today. Dr. Wilson, please begin.
Yeah, thank you. So excited to be here and so excited to follow some of the icons of the movement. It really motivated me to be a part of this movement. So I want to continue to on some of these the comments about communities and community-driven science. You think about where we are in this country, and following what Donnell said, you think about the EPA and what's happening with pollution. It's a form of state-sanctioned violence against communities of color. When you permit pollution, you're basically saying you are less than human. We're dehumanizing folks. You can go back to Dr. King's work with the sanitation worker strike. Black men carrying a sign saying, "I am a man, recognize my humanity." Same thing that happened with brothers and sisters being murdered in this country. A knee on the neck, right? That's what Malcolm X said. You saw the knee on the neck of Brother Floyd. You saw the lynch in the Arbery. This dehumanization of Black and brown people, the over-policing, the criminalization, right? It's all connected to the same structural racism. But then you get to permitting pollution, you're permitting poison, whether it be the school to prison pipeline or seeing young Black boys and young Black girls being arrested for acting out and the handcuffs too big to go around their hands. We have dehumanized people of color, and you see it again when we poison their communities, right? And so you think about these institutions and structural racism, right? How structural racism, it really is insidious. Racism is baked into the walls of the fabric of America. You can't have America without racism. You think about, apple pie is American. Racism American too. And you think about our scientific institutions and the role we play and that they play in perpetuating racism and environmental racism. You got communities who are looking for science that is active, not passive. But a lot of the science is extractive science, it's guinea pig science, right? And you think about these issues of environmental justice. I've been working in communities, doing citizen science, community-based physical research since I was a grad student, working with Omega Wilson and Western Revitalization Association. They came up with a framework called community-owned and managed research. Why? Because research before was being done on them and not with them. They were being guinea pigs in research. And so that approach was all about parity in management, equity in funding, and science for compliance. It's just not good enough to study what's happening in frontline and fence line communities. We have to translate that data to action. And COMER was created because that wasn't happening. During my time in South Carolina, I worked with the local Chilonzo model communities looking at the issues of the port expansion at the Port of Charleston, right? And so we were able to build a community research partnership to apply some of those principles of community-owned and managed research and bring that work and help that community shut down an incinerator. As a grad student working with Omega Wilson, we were able to get people first-time installation of sewer and water infrastructure, right? These are communities that were pre-New Deal communities who didn't have access to publicly regulated sewer and water, who didn't have paved roads, right? And so you think about the role, again, of science. A lot of science, again, is extractive, it's colonial science. It's science where we're studying problems, but not translating the data to action. You think about Ernest Boyle's 5 dimensions of science. He talks about the science of inquiry, the science of teaching, the science of integration, the science of engagement, the science of application. To me, if you're not doing all 5 dimensions of science, you're doing incomplete science. In academia, the culture of academia, we commodify, incentivize discovery science. We incentivize pain pipping science, studying what's wrong with you, but not what's right with you. EJ communities need science to know what's right with you. Asset-based, right? Solutions-oriented science, okay? And so you think about that type of work. Unfortunately, in academia, we don't incentivize solution science. Or people say, Jacoby, it's not my job to translate the action. I'm supposed to be objective. There's no objective science. Everybody's biased. Your cultural lens and your experiences inform the science that you do. But Dr. Mills McClain says, Harambe House in Savannah, Georgia, she says, frontline and fence line community members who deal with environmental justice issues, they are the true subject matter experts. So we should value and uplift community cultural knowledge systems that make sure that science is actually impactful. Think about the billions of dollars that have been wasted to study problems in this country, instead of being invested to build communities and to empower communities, to use science in a way that actualizes that power, to give voice to those communities. And so what we need to see is more community-driven science, more science that focuses on action, more science that focuses on social justice, more science that focuses on social change. And fundamentally, the scientific industrial complex in this country is racist. And why would I say it's racist? Look at the funding disparities when you think about NIH and who's getting funding. Think about tenured faculty in this country. At PhD degree institutions in this country, 70% of tenured faculty in this country are white. Only 4% folks Black. Of all the funding that goes to the federal funders to institutions of higher education, less than 3% of that funding goes to historically Black colleges. So you have a racist scientific research enterprise. So how are we going to solve problems like environmental injustice if we don't have people on the pathways to getting PhDs, if you don't change the culture of those environments, that we value the cultural knowledge systems and their lived experiences, if we don't have funders like NIH, NSF, EPA, CDC, NOAA, DOD, DOI, USDA, HUD, making sure that you have peer reviewers who look like the folks in communities, making sure that the peer reviewers who have implicit bias, they shouldn't be allowed to review proposals, and make sure that when you're getting funding, that we focus on impact. I don't care about innovation if it doesn't lead to real change. I want to see the impact of your proposed project. Did you clean the air? Did you clean the water? Did you increase access to housing? Can you give people access to food? Are you focused on just sustainability and building community resiliency and building healthy community ecosystems? That's the science that communities need. That's the science that EJ communities need. And we need to transform our scientific enterprise that makes sure it's less extractive. We have too much scientific colonialism, too much scientific racism, and too much scientific imperialism. The top 20 institutions that get the most federal funding are taking up all the dollars. We need to make sure community groups are getting those dollars so they can do their own research, and the institutions that serve them, like HBCUs, like Native American service institutions, like tribal colleges, as I just said, HBCU institutions, and Hispanic service institutions, that they're getting the funding too. I'm getting excited. I'll stop there. I'm over time. Thank you.
Kobe, you're in the right place. Wow, that was powerful. Thank you so much. We're excited to talk more about you, about those issues. Awesome points. Also very true. Our last presenter, Michelle Oko. She is a senior lecturing fellow in the Duke Environmental Law and Policy Clinic, where she supervises students on environmental law cases and teaches sessions on environmental justice and administrative law. She also teaches a readings course on environmental justice that is open to all Duke Law students. She's currently serving as a section counselor for the environmental section as well. Michelle, please begin.
All right. Thank you. Today I'm going to present on the APHA policy statement for environmental justice, and that is entitled Addressing Environmental Justice to Achieve Health Equity. And the important part to notice about that title right away is that environmental justice is part of the effort we need to put forward to achieve health equity. We will not be able to achieve health equity until we are able to address environmental justice as public health professionals. Now, as was mentioned earlier, environmental justice is inextricably linked to public health. We cannot go about achieving health equity without that piece. And the APHA policy statement is very significant in that it is APHA's official position when it comes to legislation and regulations that we may recommend moving forward. So this is an official position of APHA and is important for us to be aware of as public health professionals. Now, APHA, as you all may know, is the primary voice for public health advocacy. And it is important to note that with environmental justice, and this is addressed in the policy statement, there are those who may be unaware of issues related to environmental justice. There are those who may be opposed because they're used to thinking about public health and issues of environmental justice as being focused on the individual level related to behavioral change. But as our previous speakers have suggested and have argued very, very correctly, the issues that we see with environmental justice are related to race. Race is the primary indicator of where a locally undesirable land use is likely to be, and other environmental hazards as well. So it is important to note that we cannot look at environmental justice issues separate from race. And when we are talking about vulnerable populations, that does include BIPOC communities. So environmental factors to address those has to be also taken into account. Also, they cannot be explained simply on a genetic basis. Epigenetic factors, as far as how genes are expressed, is influenced by trauma and stress that is related to racial tensions that we see in this country. And we also have to understand that those biological factors, we cannot just explain off in such a fashion, because race is simply a social construct. So these are not explanations as far as why is environmental justice not significant, nor is it in any such a justification to say that it's just where people move for economic reasons. We have a history of redlining and segregation in this country that cannot be ignored. Not only that, we have to take into account economic pressures that exist because of that history. So that is not a justification, nor is the idea that we have to sacrifice certain communities so that we could have economic progress, or even in some cases, environmental solutions, right? We should not be sacrificing communities. We have to be able to address health equity. And to be able to achieve that, we need to uphold principles of environmental justice. So very briefly, I just wanted to go ahead and take your attention to, as was shared in our chat, the policy that was put forward by APHA. So you'll notice that there are 15 recommendations that were brought forward. And these recommendations apply to institutions and organizations. That includes government, academia, nonprofits, and private companies, and also public health professionals like yourself. You will notice that the first recommendation is in relation to diversity, equity, and inclusion in environmental and public health sectors. That is an acknowledgement of structural racism and how it impacts environmental justice, and goes back to being able to overtly address issues of funding and publicly backing research. And not only that, as Dr. Wilson brought up, research and actually faculty in this regards. So if we have unequal representation in academia, in environmental organization, that is going to go in connection to more disparities. And then also part of this same recommendation is to overtly address implicit bias. So then the second recommendation goes to preparatory work or pre-work. It is important to note that if we take neutral policies and implement them in an unequal society, what we will ultimately do is perpetuate the same disparities that currently exist. In some cases, may even exacerbate them. So it is important to do the groundwork at the beginning to identify specific support structures that exist in communities and realize the competencies that are needed to facilitate engagement based on those specific communities. That means specific strategies up front. And then the third recommendation, for public health agencies to partner with social justice actors and organizations to tackle the social determinants of health. That means that it is simply not enough for us to exist in our silos. Environmental justice is intersectorial. It crosses sectors, interdisciplinary. So you have to be able to have multiple actors on the table and realize that connection to the civil rights movement, and realize that it is important to have those actors at the table when we are addressing issues related to the social determinants of health. And then the fourth recommendation relates to meaningful engagement. Now, this is very important, and this came up several times with our previous speakers. Environmental justice must be a collaborative process. It must be community driven. That means that communities must work with us as partners. Now, I know as professionals that may be a challenge, but we have to realize that the communities have their own expertise, which we need to recognize in our work in order to be able to move forward and enact real change to address health equity. And another thing to keep in mind is that our efforts must not be disempowering. These communities have voices. These communities have agencies. Our role as health professionals is not to give them a voice because they have one. Our role is in partnership to use the skills that we have to assist them in being able to have those voices be heard and recognized. Now, that's the important part of the fourth prong, meaningful engagement. But moving forward, we also must realize that there are other recommendations as well in this regard. So our fifth component to keep in mind is that we must join environmental justice communities in their response to climate change, mitigation, and adaptation. Now, this is important because remember I mentioned earlier that our solutions up front have to consider issues of environmental justice. The same thing is in relation to climate change. We cannot, in the solutions that we develop, ignore environmental justice communities in mitigation and adaptation. So they need to be included in the components addressing energy justice and we need to also incorporate disparity impact analysis in the work that we do. Now, our sixth recommendation, sustain health coverage for environmental justice communities, as well as expanded healthcare and support in the face of environmental disasters to thereby reduce disparities. We have to realize that yes, there's a relationship between healthcare and community health when it comes to environmental justice. And that is especially significant when we're dealing with issues of environmental disasters. One of the things that was brought up earlier was the wrong complexion for protection. That's dealing with what we see in environmental disasters and how we as health professionals can step up and actually address environmental justice issues in relation to that. And yes, healthcare is a key component of that. And then the seventh recommendation goes back to our friend data. We need these tools to study cumulative impacts and risks associated with environmental justice. And I'm just going to wrap up very briefly the remainder. The eighth one is the environmental justice criteria and funding and requirements and prioritization. That must be come into effect. The ninth one is recognizing that cumulative impacts analysis must also be associated with concrete solutions. So that means that moving forward, we have to realize that it's a matter of junk in and junk out. We have to be able to provide the scientific data to support these communities. And then finally, I'm just going to wrap up the last five. Funding of research, and also related to that junk in and junk out, NEPA, having a strong National Environmental Policy Act that considers cumulative impact. 12, to actually join EJ communities in relation to their issues, the issues that we are important, not just necessarily defining the agenda. 13, what we're doing right now, creating a curriculum in relation to environmental justice to give the tools to the younger generation to move the envelope forward. 14, recognizing deficiencies in human health risk assessments so that they protect the most vulnerable populations. Not enough just to do cost benefit analysis, but health and the social determinants of health needs to be included in our assessments. And then finally, we've got to have legislation that supports environmental justice. And with that, I will go ahead and cede my time.
Thank you, Michelle. Phenomenal work with the policy. We appreciate you in that space and your leadership. Thank you so much. So thank you all to the presenters for their engaging and informative presentations. I will now invite all of our presenters to turn on their cameras for a moderated question and answer session to learn about the topics discussed. We will then turn the audience Q&A as well. So please, if you're watching, submit your questions in the Q&A as well. And finally, we welcome your feedback on this webinar and the post-webinar survey that will be dropped in the chat shortly. So I'm going to take my glasses off for this because we need to get down to the nitty gritty and have a real conversation about what we were talking about today, because you all mentioned a lot of phenomenal points and really, really important points as it relates to systemic racism in this space. So the first question, I'm going to loop Donna back in because she was our first presenter. I want to ask you, Donna, communities of color aren't always united in the fight for justice. What lessons can be learned from the environmental justice movement about the importance of unifying communities of color to advance equity and justice? You mentioned some lessons learned earlier. I want you to choose one of those that you think really, really resonated with you the most. Oh, if you can unmute your mic now, that'd be great.
Thank you. Thank you. Sometimes claiming our voice is just a simple click of a button. But I said, I bet I have 2 minutes in terms of that is a major question. And we went into the summit actually with that as a major question. How do we bring people to a space where they can have some sort of agreement? The one of the things that is a big part of that is what I said about learning to listen with curiosity. Oftentimes when we go into meetings, mixed group meetings, diverse groups, we go in with our own ideas and we have the answer. And when we're listening to people, rather than listening to what is being said, we're preparing what we're going to say in response. And so a lot of work was done in terms of how we begin to listen with the curiosity of the other and begin to pay attention to the similarities. That was major in terms of being able for folks to see that they can work together even across differences. I'll give an example for my own tribal government. We were working very strongly to try to get the Lumbee to come up with a statement opposing the ACP. We didn't do that, but we did move the tribe along the way of understanding what was happening, and they did make resolutions about consultation. Now we're facing liquefied natural gas from Duke Energy, and they have come up with a strong message of opposition. How that happened was a person got invited who's very conservative politically, but listened to all that was being said about the impacts on culture and community. And she was the one that formed a natural resources committee and actually drove the council to move to pass the opposition. So she kept saying to me, you know, I'm politically conservative. And it was like telling herself that. But she and I had worked together probably 2 decades now for social change. And so it's a matter of getting to the place where you can listen and hear the real message that's coming between you.
Thank you for that, Donna. It sounds like a bipartisan approach is important as well as the intersection of partnerships. I want to ask Jacoby a question because you mentioned the importance of listening. And Jacoby, you were suggesting it's not enough to listen and do research. We got to do some action. So I'd love for you to unpack a little bit more about there's no incentivizing solution-oriented science. I'd love to hear more about that point.
Yeah, I think it's important to note that if you look at team promotion guidelines, particularly not, you know, I'm in the school of public health. It's really interesting that schools of public health, we're doing, what I do is really public health practice. It's solutions, it's policy. We don't have practice categories in many of our team promotion guidelines in multiple schools of public health across the country. Mm-hmm. We don't actually define practice category at my school of public health. So you think about someone going in the tenure track and doing this work, if it's not in the guidelines, they're going to be less apt to do the work. Mm-hmm. And we have to really change the culture, academia, and I think you have these statements about what public health is, the mission and objectives, but you have to have it on paper. And for example, CCPH, I think in 2009, Community Campus Partnership Health actually developed guidelines on team promotion for community-engaged research. 2009, I believe. So those of you who are in public health, for those of you not, if you want to do this kind of work, you have to tell your chairs and deans, you can't just talk about it, you got to be about it. You got to have metrics on paper, y'all. If it's not on paper, it doesn't count. And what happened with me in my team process, which I won't do in great detail, it wasn't great. Half of what I did didn't count because it wasn't on paper. So that is a deterrent. I think also funders play a major role. I think, and hopefully this new administration, this will happen, we need to overhaul the whole federal funding system. I would like to see NSF's point about broadening participation, that be adopted by NIH. I would like to see a real category on diversity and inclusion be adopted by NIH when it comes to the actual proposals. I want to see, as I said, some clarity about what is impact. You just doing innovation means nothing to my community if you're not actually showing how you're going to impact these issues. We need to invest in value impact. And what we've been valuing is actually pain pimping science. I'm going to say it again, y'all. The more you go into the human body, this is my bias, the farther you go away from the actual solutions. It's upstream, cleaner air, cleaner water, give people access to healthy foods. It's just sustainability, just transit, just housing, just food, just healthcare. That's the science that we need. So we need to focus on more applied science and less on discovery science across the board. And so I'll stop there.
Thank you, Shakobi. That's really important, Dr. Wilson. I apologize. Yes, you're right. And you mentioned a very important issue of implicit bias that is becoming more of a conversation, is rampant in our systems. So I want to kick the next question to Donnell in response to Dr. Wilson. You touched on implicit bias and the dismissal of humanity when it comes to communities of color. Very poignant point. How have you addressed this in your work or called upon others to lead with a racial equity lens?
Oh, that's a good question. I think, first of all, it's important that I acknowledge the principles for environmental justice, because that really define how we on the front line in these communities speak for ourselves. And just because someone else does not value our voice or value us doesn't mean that we have to go along with that paradigm. Our communities are done with dying for something as asinine as racism, and the rejection of us as human beings. Even to your first question to Donna about why even people of color from different ethnicities find it difficult to work together, because of the systems that have been put in place where we're competing almost to race to the bottom. We have to make sure that within our communities, we acknowledge we are human, our lives are valued. That's how I have led the efforts and worked with others in our local communities at the state level and national level to ensure that our voices are raised to a point where we're fighting for our very lives. And I don't care what anybody says, it is my life, it's the life of my community, it matters to me, and we're gonna fight for it. And anybody that is supposed to be representing me in office, in political positions, or even in academia or whatever, there is a protocol that I'm expecting as a citizen, as a resident, as a taxpayer, that I expect from these institutions and those people that get into office. They will hear from me, and that's what my work has been all about. And in making certain that folks who are not represented in these spaces know that they have a voice. So every time we engage from young people to returning citizens, because we do a lot of work there as well, we are all about them understanding that they have a right to a quality of life that every human being has. I have the right to breathe clean air, to drink safe water, to be in playgrounds and in school buildings where I am safe, where I can learn, where I can worship in our places of worship, like any other human being. So making sure that voice, we're speaking for ourselves and not allowing other people to speak for us. But if you're willing to work with me to make it happen, that's how we do this, in collaboration and ensuring, even when it comes to community-based participatory research, or even how Dr. Wilson has described it, it's about us not being the guinea pigs.
Thank you,
Dr. Us defining it.
Yes.
Touched on something for me, so.
No, that's why we're here today. Thank you for that. And you and Donna both are fighting for a specific demographic of your community. And it's interesting, you got Dr. Wilson fighting in the institutions to actually help people obtain funding to help those various communities. So, but Dr. Wilson mentioned as well that there's not as much movement in our institutions, or people are thinking of these opportunities, but not implementing them, right? So I want to kick the next question to Michelle. There are many recommendations that listed in the Addressing Environmental Justice to Achieving Health Equity policy statement that you went over today. Can you provide an example of how institutions actually currently implemented it? Because we're noticing there's a lot of science, a lot of talk. Who's actually doing the work?
Yes, well, I think some of it comes down to, as you know, Dr. Wilson said, just actually standing up and making sure that your institution does so. I'm remembering back when I was a law student in 2009. That's when I graduated, and I was very much so interested in environmental justice issues. However, I did not have that term to put to my issues of concern. I knew that I was interested in environmental law. I dedicated myself to environmental law, but I did not have a community or a network or even curricula to support that interest. So moving forward, you know, what I did when I joined academia was I made sure that happened. So one of the things that I did when I came to Duke was I created an environmental justice readings course. It's the beginning, but my hope is that that will sustain students who were like me so that they have the foundations of environmental justice. So I think some of that is actually standing up for our institutions, making sure that it gets put on paper and that we are actually teaching it to our students. And then also, you know, one of the things that I go over with my students as well is some of it comes down to questions. So like, for example, if you are dealing with a cumulative impact assessment, are you just accepting what you receive on face value? Or are you asking further as far as like who is actually being implemented? Have vulnerable communities been included? So I think some of it just means actually challenging the norm that is there and being bold enough to say that this issue is important to me. And the same thing with environmental organizations. I have seen a huge shift from where environmental organizations were 10 years ago, where it was a side fringe issue that community groups dealt with, to actually trying to move towards making it central to their mission. However, the important thing to note is we are not there yet. So to actually push environmental justice so that is in the forefront, I think is very important. And no matter what is your role. So even, you know, academia, if you're, you know, actually, you know, an MD treating patients, are you doing screening in this area? We know there are health disparities in relation to environmental justice. Are you thinking about those questions?
Thank you, Michelle. Great insight, and thank you so much for that. I'm curious, you all. So I'm studying sustainability now, and you know, shout out to Wake Forest University. I'm studying sustainability, and I don't hear enough about people talking about cleaner energy and the direct intersection of climate change, cleaner energy, sustainability, and health. So this is for everyone or anyone to want to respond. We're going to open up to you all. What connections are you seeing in putting responsibility on corporate companies not being sustainable and the racism and the environmental racism we're seeing in our communities?
Yeah, I'll try to be succinct. Being about the issue of energy, you look at along the whole energy continuum. Communities of color, low wealth communities are disproportionately burdened by energy. So extraction, whether it be traditional oil and gas wells or fracking, right? The transport, as we've already heard, when it comes to the pipelines, also the transport of coal by rail. You also have that issue. Then the processing, right? Refineries, Cancer Alley, Houston Ship Channel, Richmond. Then the processing the products, plastic pollution, right? The emissions from those facilities, right? And the impacts on human health. Then the single-use plastics, fast food restaurants, whose communities are disproportionately in. Then the waste products. You dump in the waste, landfills and incinerators. Whose communities? The whole continuum, the whole life cycle of fossil fuels, combustion of fossil fuels, traffic-led air pollution, right? Impacting these communities. And then you get the issue of energy equity. Folks have to choose between paying for their grocery bill, paying for their medicines, and paying their energy bill. Or as some folks in Detroit are working on, and other people in Flint and also Chicago dealing with water shutoffs, people dealing with energy shutoffs, so energy affordability issues. So there's a lot of EJ issues there, right? And I think part of the solution is if Dr. Bullock says these communities, our communities are hit first, worse than most. When it comes to investments, they should be first in line and get the most investments. So renewables, electrification, smart grids, right? Workforce development opportunities, infrastructure investments. Electrification should be seen as a public health intervention. On the disease side, asthma side, pollution side, community sustainability, and economic justice side. So I think there's a lot of opportunities to think about the climate component too, the climate change issue. Doom and gloom is not going to work for us. What's the opportunity structures? And I think that's what we need to, when we think about investing and those intersection of those issues, we need to invest more in these communities. And I think climate and energy is an opportunity for frontline, fifth line EJ communities.
And if I may, I agree with Dr. Wilson, and actually, Shakobi, you said it all. I will say in terms of some of the response to that, like one of the things we're doing here at Green Door, we provide workforce development in the environmental and green collar sector. We're adding, we've been doing weatherization and that kind of stuff, but we have this whole sort of trajectory from clean up to green up, to disaster response, to resiliency and stability and sustainability. But also for us right now, we are considering this huge opportunity to be in partnership through a social entrepreneurial point to host a really unique solar manufacturing system that is proposing to come to Detroit, where there will be, the model includes ownership by the workers and led by a nonprofit, which is really very exciting. That will not only include manufacturing, but installation of solar, this unique approach that they're doing, which is a little different, but this unique opportunity to provide the solar installation to low-income residents for free. That gets to your point about first in line, investing first. I'm very excited about doing that. That's the kind of capacity and whatever we need to have on the ground. And as we are trying to lift up our communities and right the wrongs of this, this whole ordeal. But you're right, it's across the board, and there are opportunities across the board. And here's the final statement I'll make on this one. We're done with being the last ones observing others benefiting, building wealth for themselves, going to communities where they are healthy and extracting every kind of resource out of our communities. We're done with that. And there's nothing that says that we cannot be in front of that. And I'm a big advocate for leading that with our visions and making it happen. So I'll stop there.
Thank you, Donnell. That is so important. You made so many important points, and you're right. I love that concept of investing there first because it's so important. Wow, I don't know where to start. So before we go on to our Q&A, I want to ask a question for 30 seconds response. If you think you can't do it, don't jump in. But where do you see the environmental justice movement in 30 years? Where do you see us?
I want to jump in. I think we're at the beginning of our future. And I actually am very optimistic about this moment in time that's going to propel us to the space where we won't be having these kind of conversations. This will be history. This will be history that we look back on and say we learned some lessons. But it's time for us to step up to make sure that occurs.
Thank you, Donnell. It's so encouraging. All right, very encouraging.
I can jump in real quick too.
Go ahead.
To follow on that point, if some of the programs and policies, initiatives, and the leaders who've been grown and who've been nurtured can step in with this current administration, and we can maximize potential, I agree with 100% with Donnell. We should accelerate the pace to really be building healthy community ecosystems, but really getting reparations, man. That's what Donnell was talking about. Reparations. That's what we should have. The wealth gap should be decreased. For $100 for every white person, $10 for every black person, in 30 years, that wealth gap should be gone if we handle our business beginning right now with a lot of these policies. I wrote a blog on Medium said, "Will Biden be the first climate justice president?" If we can get half the stuff done, we have a chance.
Yes, and Yes, and I wanted to also jump in really quickly because to conceptualize where we were 10 years ago, I see us making dramatic changes as far as environmental justice is concerned. You know, we went through a situation, as I mentioned earlier, where, you know, environmental organizations were looking at it as a side issue, and now it has become a central part of their mission. We we're at a position where we only had, you know, our executive order in place, you know, for environmental justice, but we're seeing that being mobilized in more places like states for actual environmental justice statutes that are being moved to be on the books. Even at the federal level, right now we're looking at Environmental Justice Act for All that is in Congress. So in 30 years, I see us actually being close, if not actually being to the point where we have achieved environmental justice, because just over the past recent years, we have been moving so quickly. The important thing is to keep that momentum going.
Thank you, Michelle. So many important points. You're right, and we have to keep the momentum going. So with that, I'm thinking of our future generations. And so I have a question from Keandra Jenkins. She asks, where does environmental justice advocacy work begin for a young professional who is just beginning to get involved with their community? Any suggestions for Keandra?
It depends on where Keandra wants to start, like in her own community, where she's being educated or whatever. Start right there. There is somebody, some entity doing some kind of work, and join forces and be, like Dr. Wilson made the point earlier, be available. I believe you also, Crystal, be available with your resource, with your skill set, with your talent and your heart. Be respectful and be there and fit in where you can. You know, get in and fit in, right? Trying to keep up with Shakobi here. But we always are looking for young people, bright young people who are willing to come in, learn, add, and be a real resource. So there's plenty of opportunity there.
And I would like to jump in with that as well, because I was thinking almost exactly what Donnell said, that you start where you are. I often get the question of how do we support what you're doing if, you know, from people who don't live where I am or who aren't involved. And my answer is you start where you are. And as Donnell was saying, you find the work that is going on and it will always be there. And then you'll find a way that you can live out of your own values while you're supporting the values of the community that you're living in. I was thinking that 30 years since the first summit, you know, the new professionals are coming out now who weren't even thought of at the time that first summit was formed. And then the second summit was 10 years later and came out with the principles of working together, which doesn't really get noticed, but it's a very important document because it talks to these issues. How do we relate to each other in our community and outside of our community? So I'm excited to hear that question, because that's exactly the generation that I think is going to take us into where we're supposed to be.
Yeah, I'll tell you real quick.
Sure.
You bringing skills to the table. It's not about your degree. I tell my PhD students all the time, it's about the skills that you have that you leverage to help, right? So you think about the infrastructure that's already in the community work organizations, whether it be grassroots groups, find a grassroots group. You can't find a grassroots group, work with a proxy group, right? You can work with a health department. You can work with a healthcare organization. You can work with a chapter of Moms Clean Air Force. You can work with a chapter in WCP, right? You can work with a fraternity sorority. Maybe not my fraternity. I'm not be bad. I'm an alpha, by the way. Work with AKAs. They seem to have their EJ program together. You know, Vice President-elect Kamala Harris. You go to AKAs. But also the NLCP, seriously, they have a climate and environmental justice program. So NWCP could be a way to begin connecting, providing. Think about how you can provide technical assistance and consultation, leveraging your skills. That's important. What tools do you have and what tools you can share? If you understand that, you can have an impact anywhere.
Dr. Wilson, thank you for that. We have a question for you for clarification. What were the 5 phases of science that you referenced and who came up with the framework?
Oh yeah, Ernest Boyer, Boyer. So it's the science of inquiry or discovery, the science of teaching, the science of integration, that's transdisciplinarity. the science of engagement and the science of application. And so that's how I built my career off of that. But I learned that working with Dr. Sting Wing, the people's professor in North Carolina, who passed away 4 years ago. And then I also learned that under the wings of folks like Omega Wilson, Gary Grant, Naeem Muhammad, and others with the North Carolina EJ Network.
Thank you, Dr. Wilson. I do want to recognize Omega Wilson for his tireless efforts of fighting for COVID-19 in the intersection of waste disposal and the potential impact on Black and Brown communities. Question for Michelle. Michelle, so are there any states that have stronger state environmental protections for Black, Indigenous, people of color communities? Are there model states for national legislation that come to mind?
One of the states that comes to mind is New Jersey. They very recently passed an act to address environmental justice. So I think they are important to be noted. California has also been doing a lot of work in regards to environmental justice as well. To a certain extent, North Carolina is also jumping into the fray. Governor Cooper has passed an executive order to address COVID-19. And as part of that executive order, large portions of it are addressing environmental justice. So overall, I think there's a lot of progress to be noted. And also, if you look at the CHAP, thank you, Dr. Wilson, there are many, many resources to look at further.
Yes, thank you. And please do get those links that are being dropped. Those look incredibly insightful. Donna, we have a question for you. Dr. Jerry Matson asks, hello, Jerry. What are some examples of the environmental justice tools that have been required or recommended to be used in North Carolina or other states?
Well, in terms of North Carolina, I will say that part of what's happening right now that Michelle just mentioned with the executive order and the environmental justice components that's in that, some of those tools are just in the process of being developed. But one that was really significant, and I believe this is one that is spread out around the country, is a GIS mapping program. And that mapping program gives the capacity to map what is present in the communities across the state. And so this would fit perfectly. I mean, there are folks who say that the mapping program sometimes is cumbersome. There's always going to be things wrong with something, but it's the first step in having the capacity that across divisions, they can actually now have objective information about what is present in all the communities. And for instance, with the wood pellet plant I mentioned, there's like 80 different polluting sites that's very close to that. And yet it got their air permit. And so even though the mapping tool was there, it wasn't used in the decision making. And so we have to not only get the tools, but make them available to the impacted community so that they can use them when they're addressing it in the permitting process, et cetera. But right now, the GIS mapping is a major tool in order to have a cumulative effect in terms of what is impacting the communities.
Donna, you mentioned polluting sites, which leads me to my next question. So Crystal Williams asked, for you, Donnell, you mentioned racial profiling in your talk, right? So she says, I'm interested in learning more. Do you think this may be part of the reason Superfund sites exist so close to low-income neighborhoods in Indigenous lands? And you all can tag team off of each other. If something strikes you, feel free to jump in and respond to each other.
Absolutely, hands down. We have to understand, this was brought up early in this conversation about the issue of discriminatory practices and systems. Housing discrimination is as American as apple pie, as Jacoby said, right? Delegating and designating where people would live based on race has been a common practice. And while it may not be as overtly happening, it's still happening. So when you look at situations where you look at the practices that were legal, segregation was legal. Designating where Negroes would live was legal. Placing Native Americans in places where they would be separate and inundated with nuclear waste and whatever, that is legal. These are policies that have been allowed And many Americans have turned their eye away from it, ignoring it. As long as it's not my issue, let's ignore it. Why did those people move there? It was their choice. This is America. Let's admit that racism is alive and well, and there are systems in place that allow that. So racial profiling, where people live, has been the foundation for what do you call it? Lulu's land use. I can't think of the full phrase, but this is undesirable land use practices, where you go and you select a space based on where you will get the least in terms of reaction and action from the community. So people who are inundated with trying to find a way to just make it are not likely to show up and be able to defend and protect them and fight against some permit or something like Dr. Wilson stated earlier, that you're permitting a legal way to kill someone. And really that's what's happening. And that's why I said in my comments earlier, we need the public health community on board. I've been waiting for this moment a long time, because quite honestly, for a long time, the public health community has been missing in action when it comes to this. I am grateful to meet people like Michelle and Crystal and others who are saying, look, this is important enough. And of course, Jacoby, we tried to keep him in Michigan, we couldn't, but he went where he had to go. But the deal is that this is, to kind of get away from this idea of only health behavior being the way out for people to get healthy. That is such a misnomer, and we'll never be able to have equal access to a thriving life as long as the blame is placed on people. So this implicit bias is real. It is real. And I dare say that almost anyone, particularly Black folks, can tell you about an experience they done had with some kind of healthcare provider who has made some assumptions, has sent people home. This whole COVID pandemic thing. In the beginning of this plague, so many people lost their lives because of implicit bias. People were sent home and they were told they were all right and sent home and weren't given access to whatever people knew would benefit folks to keep them alive. They go home and they die. That's not acceptable. It's no longer acceptable. And when you're in places where you are exposed to the pollution, air pollution, water pollution, whatever, and now you got, you're already impaired, the respiratory system and stuff is already impaired, and that, and then you got this deal coming at you that's going to go right to your most vulnerable areas in your body. And then we expect to fight that. We're expected to fight and survive that, or who cares?
Yeah.
Well, I have to jump in here right now, because when you asked this question, my body kind of started moving with it. Because I want to say that at the root of the country is extermination is a value that's at the very basic foundation of the establishment of the United States, in terms of looking at the colonialism that brought so much to be. And I don't want to just make a negative statement like that, but to show the resiliency and how we, by bringing together our capacities, our assets, we can overcome even the desire to exterminate. In the late 1800s, there was a plan to do away with the buffalo, and there was pictures of the mounds. If my technology hadn't been messed up, I would have started with a picture of the mounds of buffalo skulls rather. That was put into place because they wanted to move the Plain Indian off their land. And so if they killed the buffalo, they knew they would have to move. And what happened was not only the death of the buffalo, but almost the death of the indigenous peoples of the plains. And so it didn't matter, because the policy was an extermination. In fact, the quote that was made during that time was, kill every buffalo you can, because every buffalo dead is an Indian gone. And for them, either it was an Indian gone that was dead or had moved off the land and had been put on the reservations. So I think that, when we have a process where now you keep hearing people say they want to go back to earlier times, well, how far back do you want to go? I mean, we really have to deal with the persona of this country. which is one of extermination for the purpose of gain. Now, for the positive of that is that under President Obama's administration in 2016, he signed a national act making the buffalo the second national mammal for the United States. And the buffalo is coming back with intentional actions of the indigenous peoples as well as support from other federal sources. For me, that is the best example of resiliency. Every buffalo dead is an Indian owned, and the buffalo is coming back now. And it's taken hundreds of years to get the buffalo back. But I think that for me is an image. It's always the image I land on in terms of the resiliency and working from that asset base and claiming the power and energies that we have within our communities and within cooperation and collaboration with others.
Donna, that's really powerful. Thank you for sharing that perspective of the buffalo. I've never heard of that. And that's so unfortunate. I often also agree with there's a genocide taking place in this country that is often overlooked.
Mm-hmm.
Our last question, we only have 4 minutes or so, maybe really 4 minutes. Kara asked a great question because you guys are bringing up a lot of observations about reconciliation being needed with specific communities in our country, particularly Black and Brown Indigenous communities. So Kara Rubio asks, how do we address the racist history of public health research in Black and Brown communities? And she goes on and says, how do we work to repair these relationships between researchers and communities whom they want to collaborate with? Now, this is a question we talk about a lot, but so Kobe, you mentioned this as being problematic as well. Would love for you all to expound on this question and we can close.
Yeah, I'll try to be succinct. I do have another blog I'll drop in the chat that talks about this a little bit too. I mean, you think about this, y'all. We've had an erosion of trust in science, right? We've had an anti-science administration. But you know why it was easy to erode that trust? Because we haven't made science for everyone. We haven't made science inclusive. I got a PhD. If you don't have a PhD, you can still be a scientist. That's the thing. We can't put science up here. We have to get science out to the people. And that's been the major problem and why you have distrust. If you have everyday people understand what science is and believe in science and using science, you would have better relationships. That's part of the issue, right? We're using science right now. We turn on science, we wear science, we eat science, right? We ride in science, we listen to science, we watch science. We need to make science everyday, proximal, and pocketbook. Not the big S in science, but the little s. So we got to bring back science literacy. We got to focus on STEM. But also, the scientists are doing the work, got to look like folk in the community. Less than 4% of folks in this country who are tenured are Black. Are you kidding me in 2020? The funding disparities, y'all, the pathways to success. Folks don't stay in academia because of the culture. So we have to fix that. We have to make kids like me as a 5-year-old who wanted to be a paleontologist. I still like dinosaurs. I'm not a big Jurassic Park fan. But love science, continue to love science, right? That's what's missing. Is more folks who are scientists who look like the folks in the communities. That's where we have to start. And we have to start early, K-12. And I will be quiet. Thank you.
Thank you, Dr. Wilson. Any 30-second comments? I will squeeze you all in. This is so good. 30 seconds.
All right, really quick. One thing I think is really important as a researcher is to realize that whole role as a community as experts. You are partners. So you cannot go in with a top-down agenda and to expect the community to serve as your subjects. That means that you have to take their voices, their narrative into account in the work that you are doing.
Yes, Dr. Okoye, and I want Donnell. Yes, Donnell, please close us out.
As a CVPR activist and a person who's been involved in this for nearly 20 years, it is crucial that we are part of the team and building that capacity for communities to be engaged so that they can define what that research looks like or whatever, and that there is some kind of intervention that would benefit the community now and not way out in the future somewhere, even if it's public policy. That has to be an important element and essential to everything we do around research.
And I would like to add that there are some formal programs in place through the academies, through through the universities. Dr. Ryan Emanuel, who's at NC State University, is a part of the team to have cohorts of doctoral students and other academic scholars to connect to the traditional knowledge in indigenous communities. This is a formal program. There's legs to it. It's been around for a few years, and one that I would recommend anybody could be in touch with Dr. Ryan Emanuel for more information.
Thank you so much, Donna. If you can drop that link in the chat, that'll be great. Well, I want to thank our presenters today for their informative and enriching presentations, and to APHA staff who worked tirelessly to produce this event. And many, many thanks to all of you for participating and your thoughtful questions. I'd like to remind everyone that the recording and slides will be available at the link provided, and to please complete the webinar survey, which we will be redirected to shortly. Thank you for tuning in today, and this concludes the webinar. Thank you.
Everybody.